Do you suffer from poor circulation in your legs? Are you concerned about blood flow in your legs, post-thrombotic syndrome, DVT prevention, lymphedema, long-distance flight syndrome, or professional athletic enhancement? Do you have painful swelling in your legs, diabetes, varicose veins, chronic venous insufficiency, or require compression stockings? If you answered yes to any one of these questions, the VenoWave could be the solution you're looking for. The VenoWave is a compact, battery-operated pump that generates a wave motion on the lower leg. Its patented wave motion increases upward blood flow in the veins. The VenoWave increases peak venous flow in the popliteal and common femoral veins, as measured by duplex ultrasound. Published clinical studies in peer-reviewed journals attest to the efficacy of the VenoWave. The VenoWave is an FDA, CE, and Health Canada approved ISO-compliant Class II medical device. Dr. Jack Hirsch, retired, Chief Scientific Officer and Professor Emeritus at McMaster University, Canada, Director of the Henderson Research Centre, Member of the Order of Canada, and Fellow of the Royal Society of Canada. Dr. Hirsch developed a world-renowned thrombosis and atherosclerosis program in Canada.
The VenoWave has the potential to help anyone whose symptoms are caused by sluggish blood flow in the veins of the leg. So people will tell you that if they have a job which requires them to stand, that at the end of the day their legs are swollen, their ankles are swollen, and their calves are aching and so forth. It's about 50% of such people do not have previous venous thrombosis, they just have defective valve function.
My training here in McMaster was after medical school. I completed internal medicine and then 2 years in thrombosis with the clinical team here, which is world renowned. And then I went off to Boston and spent a year doing a clinical fellowship in vascular medicine. In individuals who have chronic leg swelling, the VenoWave can be very helpful, and that could be due secondary to a deep vein thrombosis where an individual is left with venous insufficiency. In that scenario, the VenoWave can be very helpful to prevent end of the day leg swelling or substantial leg swelling. Well, I think a big advantage of the VenoWave is it is a portable device and it's battery operated. So individuals can carry on with their usual activities without having to sit down or be plugged into a wall or hooked up to a machine. So I think that's a huge advantage of the VenoWave. And certainly it works to decrease swelling in post-phlebitic syndrome. It works to prevent DVT.
My name is Perry Meyer, and I'm the medical director here at the Meyer Institute. Set up this institute about 5 years ago, and we're a center of excellence for diabetic foot and wound care. We saw about 16,000 patient visits last year, and about 9,000 of those were wounds, diabetic foot wounds. So it's a fairly busy practice. The VenoWave is different. So it's a different approach to this problem. It's very innovative. The advantage is obvious because for these people who have no other option other than amputation, it saves them. And they are already suffering because of pain, and the VenoWave, in our experience, has helped with that. So do I recommend it? Yes, I do, for those reasons. We have to be realistic about what the outcomes are. But these people, we are giving quality of life back to someone who would have no quality of life.
The VenoWave enables an active lifestyle for the patient and improves their quality of life.
Well, it's very simple to put on, and I find that it relieves the aches and pains. With the swelling, it will help the swelling go down faster. With the cramping, it helps relieve that ache. It makes it comfortable. Nobody can see it. You can hear it a little bit, but nobody can see it. And even if they do see it, I don't care.
I used to wear compression stockings, but they were very uncomfortable. and the VenoWave has replaced it.
I go out for about 4, 5, 6 mile runs, and sometimes it's with speed, sometimes it's just a jog, but certain days I just didn't feel like running, but putting the VenoWave on allowed me to go out, and that mobility just was fantastic to be able to keep the active life that I love to do.
The VenoWave is easy to put on and take off. Trim the neoprene flaps to fit your own leg. It should be located 2 finger widths below the crease in the knee. Use the large Velcro straps to secure the device to the leg. Turn the unit on by sliding the switch over the desired speeds. There's a quick setup guide included in the package with instructions.
I don't think I would be able to live such an active life. The fact that the VenoWave creates circulation makes my life a lot easier.
It helps you walk because it's helping with the circulation. You can do anything you want. I can be active with my grandkids and wear it. I want them to say my grandmother was busy with us, type of thing, you know. That's important to me.
There was nothing better that worked. It massaged the leg tremendously, helped with the circulation, and really alleviated all the issues I was having with pain and stiffness after my running.
Even though my mother was old, she had great healing capabilities if she had a good blood supply. I feel that if I had known about the VenoWave when the first injury had happened, that she would never have had to lose her leg. My mother was in her early 80s, and she had developed an ulcer on her toe. It's an open wound that wasn't healing. We took her to see the best doctors, vascular surgeons. They had nursing care coming to visit the house every day, but the wound wasn't getting any better. What I would do is I would strap it to her calf and sit down and have it play cribbage for a couple of hours. And after doing that for about 30 days, the wound was completely gone, completely healed, nothing at all, no problems with it. I mean, considering the 14 odd months or so that my mother had with her first ulcer, and the amputation cost of probably somewhere, the total cost would have been probably somewhere in the neighborhood of $20,000 to $30,000. And yet a simple VenoWave would have been a fraction of that cost. So it makes a lot of sense for people who have serious issues to use the VenoWave.
The VenoWave is an effective drug-free therapeutic solution. It can be used in hospital and at home. It offers greater effect than compression stockings alone, has good patient compliance unlike pneumatic compression devices, and is cost-effective. To find out more about the VenoWave or to order yours, visit venowave.com.